Hello, my name is Leslie, and today's topic is about cancer and how it is a large public health issue. Cancer is an interest to the world because of the 2/3 of cancer mutations that can arise randomly or the generators that play a role in cancer. This random occurrence can be explained by a random error during DNA transcription. There is a public concern that they did anything wrong to bring on their cancer, and that people stress out about every little single thing that or action that they do in their life, or everything that they touch or eat. But it is also predicted that in a society that craves control, some would be uncomfortable with when brought face to face with the recognition that the disease is actually outside our desired control. A taxonomy of public responses is apparent to relief that they did nothing wrong to give themselves cancer. Skepticism about motives, doubts about accuracy, about science, a belief that science must be wrong because cancer cannot be random, and anguish about cancer being deprived of meaning. There has also been a recent concern to almost 10 million Americans about missing cancer screenings during the pandemic. It was found that 9.4 million screenings for breast, colon, and prostate cancer did not occur in the United States due to COVID-19. Because of COVID-19 pandemic, it caused people to miss cancer screenings. It will mean the delay and the diagnosis of cancer, which means that it would be more advanced when diagnosed. Figuring out what chemotherapy and immunotherapy treatments will perform best for a specific cancer patient can be a difficult task for physicians. There is no way how a patient will react to a certain type of anti-cancer drug, and time usually is not abundant to perform trial and error. Testings for cancer may begin to be more advanced as scientists from Ohio State University have come up with a way to come up with a solution that could prove to truly become a personalized approach to know exactly how a patient will react to different cancer drugs. These scientists take cancer tissue and create petri dish versions of their bodies to test which drug would be more effective. But because the test tube created from these patients was not an easy task, scientists came up with a way to combine cancer tissue from patients and important immune cells found in their lymph nodes using a thick substance called extracellular matrix hydrogel. Scientists become more advanced, and we now have powerful data analysis techniques that people do not question the cure to cancer as much. The cure is more about trusting the process of the test and hoping for them to be successful.